right, everyone. Happy Purple Tuesday to you. I'm News 13 meteorologist Kristen Kennedy here to raise awareness about Alzheimer's disease and share some information you may need to know, not only for yourself, but any elder loved ones you have. And today we have a very special guest joining us, Miss Stefanie Wardlow. She's the Senior Program Manager in Quality Initiatives of the Alzheimer's Association in North Florida. Thank you, Stefanie, for joining us today. How are you doing?
Thank you. I'm great. I appreciate being here today.
Yeah, we have some good information to talk about, a lot of stuff that you know way more about than I do. So I'm looking forward to educating myself and everyone else watching us today as well. Let's go ahead and start and tell me a little bit about your background with Alzheimer's and how you got involved with some of the research and senior program managing.
Sure. So, like many people, I've kind of followed in the footsteps of my family. My family works in the aging field. So I really got some groundwork there working at some facilities. I was actually a CNA, certified nursing assistant, and that was my firsthand experience with Alzheimer's disease. And then unfortunately, it did hit my family. My grandmother actually had vascular dementia. So I experienced that with her. My mom was her caregiver. And during all this time I was studying, I was in school studying gerontology, and then I got a degree in adult education. And through all of that, I got to work for the Florida Policy Exchange Center on Aging, which is at the University of South Florida. So I got to help different researchers, which was really exciting for me. So that's kind of in my background. I also was with the Florida Center for Creative Aging, and they did a lot of arts-based programs in the community, and specifically for the aging community, that is, but also for those that have dementia and Alzheimer's disease and dementia. So I was offered a job at the Alzheimer's Association, and I think it's because of all that work that I had done.
Yeah.
Well, I had been here since 2005, so I'm a seasoned employee, staff employee. I'm probably going to be here until I retire, whenever that is. Like, I don't know when retirement is. But I recently, and I say recently, it's been about 3 years, been appointed one of two research champions here in the state of Florida, which really means that I am volunteering to educate myself more about research so that I can spread the word about the good work that's going on, not only here in Florida, but in the United States and across the world. And my coworker, Keith Gibson, he's also a research champion. We both get to go to AAIC this year. That's the Alzheimer's International Conference. It's in July. And I am so excited. I hear there's a lot of Florida researchers that are going to be there. So I'm hoping to do some recordings, meet them, and hopefully post them on social media so that everybody can see.
And probably take lots of notes too, huh?
Yes, absolutely.
Well, it's awesome. I think it's really important that, people do educate themselves and learn more. And I think it's amazing that you're kind of volunteering to get all that information from researchers as well and compile that information so you can spread it and help even just people like me learn more about it too, which is kind of what this interview is going to be a little bit about, just kind of sharing some of your knowledge and some of the research that is going on. To start off, can we discuss a little bit about the risk factors of Alzheimer's and what people should be looking for if that is a concern in maybe someone they love or know?
Sure. And that is a great topic. And I'm going to break it down into two components. I'm going to talk about non-modifiable risk and modifiable risk. So first of all, we know the causes of Alzheimer's disease. Research believe it's not just one single cause. So it's multifactorial. There's many things going on. We got genetics, we got lifestyle, and, in the environment are likely all involved. So based on the research we're seeing across the globe, we know that there are things that may make up risks that are both the non-modifiable and the modifiable. Those non-modifiables are those ones, unfortunately, we can't control. So age, I can't control my age. Mm-hmm. The older I get, the more likely it is that I could get Alzheimer's. So my risk is higher. After the age of 65, risk for Alzheimer's doubles every 5 years. And then after the age of 85, it gets much higher. It's nearly 1/3. So we've got age, we've got genetics, and then in our genes, there's actually two categories of genes. We have a risk gene, and then there's a deterministic gene. And we found Alzheimer's genes are in both categories, risk and deterministic. So for the deterministic genes, they're very rare. It's only about 1% of Alzheimer's cases are caused by the deterministic genes. There is a lot of focus on genes, a lot of research. I know at AAIC, there'll be people actually from the University of Miami that are going to be presenting on that topic. And I look forward to bringing that back to everybody so they can learn more about it. More on the non-modifiable risk. So we've also got race, ethnicity, sex, and gender. And those are constructs that we still don't know a lot about in terms of how they apply in the risk for Alzheimer's disease. So we need to learn more. Then we have modifiable risk factors. These are the things that we could possibly change. We have the most influence over. So we're talking physical activity, cardiovascular health, sleep, diet, our environment to a certain extent, and then other lifestyle factors. And many of these combined together may drive our overall risk. For example, we have, let's say I'm a smoker, right? If I decide to stop smoking, that could lower my overall risk. But if I'm also eating really poorly, I'm not sleeping, I'm not exercising, then that overall risk score is probably going to stay close to what it was before. But if I can combine, making better decisions, then my risk score could be lower. Now I say risk score, that's my own terms. That's not necessarily in the research. You can't go somewhere to get your own risk score. I'm just trying to say it to place this into perspective. One other thing that we have to keep in mind when we're talking about overall risk is social determinants of health. So social determinants of health may impact some or all of these factors, so these risk factors. And, we're all very unique. We come from different backgrounds. We have certain styles that we tend to adapt to. We are with different groups and we're in different populations. So in terms of research, when the researchers are out there looking at risk, they have to take all of this into account because, one thing that's going to be good for one person might be totally different for another person or another group. But what is clear from the research is that we have to do a lot more work. Mm-hmm. And this isn't different from any other disease area. I want to point that out. This is not unique to Alzheimer's disease. It's for all diseases are like this. We really need to study risk from all angles across all individuals and all groups so that we can help define and strategize for better risk reduction in the future.
We talked a little bit about reducing the risk. Is there anything else you want to cover with reducing the risk?
Yes, thank you. Okay. So there's much research into understanding risk, as we kind of discussed. The strongest evidence to date, though, is research around keeping your heart healthy. So this is very common. You probably heard it before, what's good for the heart is going to be good for the brain. So that concept has been talked about for some time, but there's actual evidence to show that there's some weight to it. So I don't know if you've heard of the SPRINT Mind Study. The SPRINT Mind Study is pretty exciting because it actually shows that if you can take care of your heart, you're actually reducing your risk for cognitive decline and maybe dementia. Now that dementia component to it's being researched in the SPRINT Mind Study Part 2, just to make sure that the data is very clear. So we're kind of not clear if reducing your risk or controlling your blood pressure. When we say controlling your blood pressure, the research study controlled it to 120 systolic or lower, and that's the top number. So we're talking very aggressive treatment of trying to control blood pressure. And they had different mechanisms to control it. In terms of like our own day-to-day lives, though, everybody gets their blood pressure taken at least once when they go to the doctor, if not more than once. So I would just suggest keeping an eye on your blood pressure because there is definite evidence to say that if you can keep it under 120 systolic, that you're reducing your risk of cognitive impairment, mild cognitive impairment, and maybe dementia.
Okay, awesome. That's really good to know. And I guess more people should be taking their blood pressure, even just to check it from time to time, even if you're not super concerned about your health, but just to be aware of those numbers further down the road. So I know you just spoke a little bit about the SPRINT Mind Study. Is there any other clinical trials or medication that has helped with maybe slowing Alzheimer's or just working with the progress of the disease?
There is, but before I go too much into detail, I forgot to mention the Lancet Commission report, which is incredible. It came out, and there was another one in 2017. The one I'm talking about is the 2020. It's the Lancet Commission report on dementia. And what it showed is that up to 40% of dementia cases could potentially be prevented or delayed by targeting some of these modifiable risk factors. So it's always going back to these risk factors, this control that we potentially could have with these studies. And based on the research that we're seeing, it's likely that combining, again, multiple healthy factors, right? Reducing these strategies or incorporating different strategies to reduce our risk is going to be the most impactful. So for your other question, what else is going on right there? The Alzheimer's Association, if you don't know, is the largest nonprofit funder for Alzheimer's and dementia research. And we really are a global force for research. We have more than $300 million of grants in action. And it's about making 920 different research projects available. And it's in 45 different countries. And that's almost every continent in the United States, or I'm sorry, in the world. That's 6 out of 7 continents in the world, except Antarctica. We're not in Antarctica yet. So this means someone somewhere is doing research right now on the Alzheimer's or dementia, which I don't know, but I don't know about you, but that really excites me to know that, I might be sitting here talking to you, but at the same time, somebody's right now trying to investigate and either find something to help reduce risk, or maybe they're looking for a better treatment strategy, or they're investigating some way to help us diagnose this disease a little bit better.
Yeah, and it's awesome to know that it's also like a worldwide push and effort and like a community, and not just something that's happening here in Florida, not just in the USA. It's global.
It is. And speaking of Florida, this wasn't in my notes, but I just remember reading this the other day. We have since 1993 here in Florida, the Alzheimer's Association has contributed $18.9 million in research just to researchers here in the state of Florida. And there is a lot of exciting things here locally that are happening. So, Florida's not going to be the only place we need to go, but I just wanted to point that out.
No, Florida. That's good. There's a lot of efforts being made here, and it's very much so in need with the more than 500,000 people living with Alzheimer's in the state. So very important that we do get those efforts taken care of, and glad to hear those numbers. That's a lot, but still not even enough. We have such a long way to go.
Mm-hmm. It's true. We look at the entire pipeline, okay, the pipeline of medicine, for example, the pipeline of research. And it used to be that pipeline was really full of people targeting, let's say, amyloid plaque and then tau, beta amyloid or tau biology. But now, drugs are starting to target other areas. It's really growing. And as a matter of fact, there's about 100 unique therapies today being tested in clinical trials. So we're looking not only at beta amyloid, we're looking at tau biology, which, by the way, those are the two of the hallmarks of Alzheimer's disease. So we do need to look at them. But there are drugs targeting cellular communication. How are cells using their energy? They're looking at neuroinflammation, so drugs that can target that inflammation in the brain. They're also looking at vascular stress of the brain. So they're looking at the blood vessels in the brain also, and there's so much more. And this research, of course, as I mentioned, is still going on to help reduce risk. So there's a lot going on with that. One study that's happening that's really building upon this idea of risk reduction is the U.S. Pointer study, which is really a landmark clinical trial that's happening right here in the United States. It stands for the U.S. Study to Protect Brain Health Through Lifestyle Intervention to Reduce Risk. It's a mouthful, so that's why we say U.S. Pointer. The study, basically what it's doing is it's providing a self-guided and a structured intervention that's looking at these multiple domain approach to risk reduction. So I mentioned some of those before. We're talking about, diet. They're definitely going to input the idea of lowering blood pressure, exercise, cognitive and social engagement, and they'll have a few others. They're looking at about 2,000 participants. And right now we've got 25 to 27% of those participants are of a diverse population, which means when the outcomes of this happens, and we're hoping the report will be out by 2050, that we'll be able to give recommendations for not just one population, but multiple populations, that if you do this, it's potentially going to reduce your risk for the disease. So that's a really exciting study. And what's even more exciting about it is the National Institute of Health has stepped up and is funding auxiliary studies that are going along with the US Pointer study. So they were able to look at this population and say, well, how is sleep impacting the brain? Can we look at how these people's sleep maybe is hindering or helping their brain work better? There's other parts of the study too. They're looking at neuroimaging, which is huge. We need to make sure that individuals that are having cognitive impairment that could be Alzheimer's, or somebody that does have Alzheimer's, that disease is actually in the brain. So neuroimaging and looking at the brain is really, really important. They're also looking at the gut microbes. So that's another auxiliary study that's looking at the stomach and the gut to see if there's any of these microorganisms that could be protecting or not protecting the brain. And then the last one they're looking at that's added to this study is it's a neurovascular study. So they're looking at the blood flow and the blood vessels and how they're interacting with the brain and how the brain might be working better or not because of that. It's very exciting.
Yeah, that's awesome. That's a lot of studies. That's a lot of research that has to get done. Like the new drug that was FDA approved last year, do you have any information on that?
I do. I can talk about that. It's Aducanamab. So just so that everybody knows, we've got two types of drugs for Alzheimer's disease. We have the types of drugs that are widely available. You can go to the doctor and you can get a prescription for those if you need it for Alzheimer's disease. And those medications are targeting symptoms of the disease only. It's not changing the biology of the disease. Okay. So this new medication that has come out, it's Aducanamab, or the drug's called Aduhelm. So Aducanamab is like the generic name. So Aduhelm, although it's not a generic yet. Anyway, it is targeting removing beta amyloid specifically. So that's the goal of it. Now, the research that came into this is it showed that the individuals that were in the study were in the early stages. So it's the medication is approved for individuals that have Alzheimer's disease, but they're in a certain stage of the disease. And the best thing that people can do right now is to talk to your doctor about it, to make sure that your doctor is comfortable with the medication, comfortable that you are a qualifying participant to actually receive the medication.
That's awesome. I know that's a big step forward when it comes to different medications to kind of help with the disease. And that one is, I think isn't there some controversy around it when it comes to if it's available to some people?
Well, it's very expensive, and that's nothing new. Any new drug that's going to come out is going to be expensive. So okay. The drug's expensive, but also there's a symptom of ARIA with the medication, and it's not uncommon. Most medications have some kind of side effect. So the drug, when somebody's taking this medication, they have to be followed by a professional, a doctor, in order to make sure that it's not only working and it's doing what it's supposed to be doing, but also you don't have these side effects. So when we're talking about the controversy with that medication, it's a pay, who's paying for it? And I think that's still kind of up in the air. How is that going to be paid for?
Gotcha.
Another thing to remember, though, that this is the first drug in the class. So this is a new class of medication, and there's others that are coming that are under the same class. So following Aduhelm's approval, we saw a renewed excitement about treatments for the removal and the prevention of these amyloid plaques. And it's these sticky substances, amyloid plaques that are growing in the Alzheimer's brain that are, killing neurons or making the neurons die, that causes these symptoms. So this medication, again, is attacking the biology of the disease, which is a new concept. So some of these new medications that are still in clinical trials right now, they are going to be pushed forward for FDA to review them. One's through Eli Lilly. It's called Donanemab. Another one is through Biogen, Lecanemab. And another one is through Roche. It's Gantenerumab. And you can kind of hear they all have that same ending, but it's because they're all kind of having the same function. It's this removal of the beta amyloid.
Okay. Interesting. Very way over my head, but very interesting.
Me too, to be honest. I'm staying enough to be dangerous, so no problem. One thing to remember, though, beyond these anti-amyloid drugs, so these are the drugs that we're just talking about that have been hot in the news, there are over 380 Alzheimer's drugs in clinical trials today. So looking at different ways that we can help the brain maybe get rid of Alzheimer's disease. And this includes the tau accumulation, right? It includes the inflammation. It includes the brain cell health. How can we keep brain cells healthier? It looks at metabolic function and more. I'm really excited to tell you about biomarkers. So if we think about Alzheimer's disease, it was first diagnosed back in 1906 by a German doctor by the name of Alois Alzheimer's, right? And back then, there's no way that he could look at the brain like we do today. But it was a scientific revolution back then, believe it or not. They had better microscopes and tissue staining techniques. So he was able, after his patient, Augustus Dieter, after she passed away, so at autopsy, he was able to dissect her brain and look at the brain, and he found the biological markers of the disease. So he saw the inflammation, he saw the tau tangles, and he saw the amyloid plaques. And then he wrote this paper and he presented it to, his constituents, all these other scientists, to say that this is what's causing these symptoms in our patients. This is Alzheimer's disease. Mm-hmm. This is the actual look of it. Well, today we have biomarkers that can do that for us. And the word biomarkers, when I first heard it, I'm like, okay, it sounds exciting, but I'm not really sure what that is. But it's simply something that's going to detect or measure a disease in the body, or measures, doesn't have to even be a disease. It can measure something in the body. So like the PET imaging that we talked about earlier, that's mm-hmm. a biomarker because it's measuring amyloid in the brain. It can also measure tau in the brain because they have that now available, both FDA approved. Other biomarkers are being studied. We've got eye biomarkers, we've got blood biomarkers, and most recently we have CSF, cerebral spinal fluid biomarkers, which actually has been approved by the FDA. So there is a new biomarker that actually can be used by doctors. It's brand new. It might not be available just yet, but it's going to be. And basically what it's doing, cerebral spinal fluid is a little bit, it seems invasive, but it's very safe. It happens a lot. It happens more than we even think about, but they're taking some cerebral spinal fluid out, and they're looking to detect if there is presence of amyloid in the fluid. And it is very accurate so much that it's comparable to the PET imaging. In terms of pricing, we're not really clear what the pricing is going to be like, but I'm imagining it's going to be less expensive than a PET scan will be. So it might help individuals that don't have PET imaging available to them. It might be also used in clinical studies. And when we think of our clinical studies, right, we have to make sure that what we're measuring is present. So in this case, we're measuring Alzheimer's disease. All the people that are coming into the research studies, we have to be very, very clear that what they have is Alzheimer's and not something else like Lewy body dementia, right? Mm-hmm. If we're studying Alzheimer's disease and we're trying to say that this drug is going to work for Alzheimer's disease, we need to make sure it's there. And that's what's exciting about the biomarkers. It will clearly tell us that the disease is present. And it will tell us the disease is present 10 to 20 years prior to symptoms appearing, wow. Which means we have an opportunity. If we can figure out who is going to get Alzheimer's disease, we can target those individuals and target medications and interventions to maybe slow down the disease or maybe prevent it altogether. So that's, to me, is the most exciting thing that's happening currently.
Yeah, that sounds amazing. I mean, to know that you can kind of do something so simple and know with like 20 years notice that someone may get Alzheimer's down the road, yeah. and be able to mitigate that. That's amazing. Do you have any information on how doctors differentiate between Alzheimer's and other dementia?
There's actually a process that they go through. Mm-hmm. So they would do a physical, total physical. They would do interviews with the family. They would do cognitive testing. I mean, there's certain questions that have been validated that if you ask these types of questions, it could mean that they have a certain type of disease. So like, each, and there's different types of dementia. Each dementia has their unique, they cross over. So a lot of them have memory problems but some of them are very unique. So like Lewy body dementia, for example, Robin Williams had mm-hmm. Lewy body dementia. And I just read that. I saw that documentary. I don't know if you saw that.
I haven't seen it. No.
It's incredible. But his wife was saying how when he went to the doctor, he asked plainly, do I have Alzheimer's disease? You know, have I had a stroke? And it was because he was seeing some of those symptoms in himself, but his primary symptoms were leg movements, and he was having very, abrupt kind of agitation. He was having behavioral types of issues because it was messing with a certain part of your brain that controls, your
all
behavior.
Those factors. Yeah.
Yeah. So the doctors are kind of looking at that. They're looking at what are the actual symptoms and then matching them up with the different diseases. So ruling stuff out. But now with different biomarkers, these biomarkers can really say, yes, there's amyloid beta present. There's tau present in the blood that will help with the diagnostic process.
Awesome. That's awesome to know. And good to know for myself too also. Is there anything else you'd like to comment about, or you think we covered it all?
No, I appreciate your time. The brain bus was mentioned in here. I don't know if you want to know about the brain bus. That's one of the, I guess, programs that I help to manage. Are you familiar with the brain bus?
Yes. Tina was on a couple days ago and we discussed it too. But if you want to do an overview, you're more than welcome to.
Okay, sure. The Brain Bus is a statewide outreach initiative. It raises awareness about Alzheimer's disease and related dementias. It also addresses the benefits of early detection, early diagnosis, brain health, risk reduction. And we have 2 mobile units, so 2 vehicles, and we also have virtual offerings. And with this, we're able to travel throughout the state of Florida. We're focusing on underserved communities and rural communities that may not have direct access to healthcare, but we do go to every county. So this year is the first year that we have been to, well, it's estimated, it's projected that we'll have gone to every single county. So 67 counties are in the state of Florida. The Brain Bus has been at each one as of June 16th.
That's awesome. That's awesome. And so great that you have that mobile access to really get to maybe places that don't have the community base to have information about Alzheimer's or get the resources that they need. So it's a good thing that you are basically taking it on the go with you everywhere you can in Florida and helping out all the Floridians who are suffering or their caretakers who need help as well. Alrighty, well, I think that's going to wrap it up. Thank you so much, Stefanie, for joining me today and sharing all of your research information with us and everyone watching as well. We hope to keep you on board for anything in the future should we need it. And if you ever need anything, reach out to us as well.
Okay. Thanks, Chris.
Of course. Have a good one.
Bye.
Well, thank you so much for joining us for this special edition of Purple Tuesday. Before we go, though, we want to let you know about the Walk to End Alzheimer's that's going to occur on October 29th at Northwest Florida State College, and News 13 will be there to participate as well. We want to encourage you to join our team. All you have to do is head over to act.alz.org, search for News 13, join our team, register. You don't need to pay to register, but if you'd like to make a donation in honor of someone you know or care about, or just to support our cause, we would be happy to have that go towards our team goal, hoping to raise $10,000 by the end of October to one day find a cure and end Alzheimer's together.